Thank you, everybody, for attending today's seminar. Let's start our webinar. Basically, I'm going to talk about the Canadian health protection law during the health emergency. So basically, we are going to look at the analysis of the law and how much the law is going to protect us. What are the things which we need to improve in order to have a better protections during health emergencies? I'm Jawahita. Let's start on this. Basically, if you look at health emergencies require unprecedented measures because there's a need to protect public health or public from the health disaster. Such measures require limiting of personal freedoms and rights. That includes your data privacy. All of us, we experience how much we have exposed ourselves during the pandemic, the recent pandemic, especially our data have been used. And we don't have much of a complaint because we felt that's very important for public health and public well-being. That being said, that is very important that there should be a limit when the data privacy or any other freedom have been limited. It should be temporary, and the measures that have been taken should be proportionate to the need of that public interest. So what happened in Europe, the European Union altogether, they came up with regulations. They call it as General Data Protections Regulations. That one, it's updated in 2018, and that provides a lot of update into the protection of privacy, especially individual privacy. And also it's guided the government and various entities in handling data during pandemic. Unfortunately, the Canadian law is quite old, and the Canadian law, if you look at it, it's sector driven because there are laws for private sector and there are laws for public sector. And it is not harmonized at the national level because we have the federal level laws, and also we have provincial level laws. And besides that, there's no new guidelines on the use of personal data during emergency. So this COVID really had shown the weaknesses of our law. Unlike what we have it in European Union countries, they are well prepared and they have adequate law. It's not perfect, but at least they are much better than the laws and the regulations that we have it in Canada. So let's look at the purpose of today's presentation. I'm just going to introduce you the available health data privacy related laws. And also I'm going to show you the need to amend our current law to be relevant and up to date. And also since the amendments are coming, but it's taking time, and organizations and various stakeholders, how they have to set their own standard in order to manage the health data privacy. These are the things that I'm going to achieve today. You are going to achieve together with me. So let's look at the data protections and the restrictions that we have it in Canada. There are different, as I mentioned earlier in the beginning, there are different privacy laws for private and public sectors with differing obligations. Since 1990s, there are various provinces, even the federal government, they have passed laws. At the federal level, the Privacy Act have been passed to regulate the processing, collecting, using of information by public sectors. So any individuals, identifiable individuals' data that have been collected by public entities, they are regulated by Privacy Act. And when it comes to the private sectors, those who are involved in commercial activities, then we have a different law. So we call it at PPD, that's the Personal Information Protection in Electronic Documents Act. This is a federal legislation. It's any organizations that engage in commercial activities, irrespective of the location where they are, then they are going to be regulated by this PPD. But the leeway that have been given to the provinces are, if they happen to pass a similar law to the 2000 PPD law, then the provincial law would be applied instead of federal law. So it is basically this Privacy Act is regulating the public sectors, whereas this one, the 2000 Act, is regulating the commercial activities of business organizations. So there you can see it, even in the federal level, there's not one, it's not a single law, but there are two different laws are regulating two different industries. Okay, one is of public sector, the other one is the commercial or business sector. And though PPD doesn't apply to public hospital in healthcare services, because they are not basically commercial activities. But if there is any commercial activities which happens within the hospitals, then you can see the PPD would be applied into those entities. Excuse me. For example, if you look at pharmacy, the pharmacies basically, they are commercial organizations and they hire spaces in the hospitals, and therefore the PPD would be applied to them. And as I have mentioned earlier, if any provinces, if they happen to pass law similar to PPD, then the PPD is not applied to them. And for example, you can see Quebec, British Columbia, and Alberta, they have passed a similar law. Therefore, the federal law would not be applied to the commercial activities that's happening in those provinces because they have the similar law, and the provincial law would be applied in those circumstances. Now, the question is, we have various provinces. Now we have the federal law. What would happen if we were to transfer data from or across the provinces or the national borders? Okay, and which law is going to be applied? Even Quebec might have passed their laws, and Alberta might have a similar law to PPD. But the problem is transferring from one province to another province is going to create an issue because, for example, Ontario might have a different law and Alberta would have a different one. But if they want to transfer data from one province to another, which law is going to govern? And is there any rules and regulations addressing these matters? We don't have an answer to it. Okay, so this is one of the problems we might have it unless we have harmonized law that could regulate the transfer in across the provinces or the national borders. The PPD is still applied, but you could see if the provinces have passed law, then the provincial laws would be taking over this particular legislation. Now we move on to the issues related to sector, the concerns regarding sector-driven federal and provincial laws, because one of the issues that I have brought up is the interprovincial and international transfer of data. And if you're going to collect data, for example, when you and me have given data for some health purposes, we only expect those data to be used for solving that particular health concern. And we don't give them consent to use it beyond the purpose for which it have been collected. And if they were to use for other purposes, or if they have to transfer our data to other places than the places that we have given the data, then there is a need to get the consent. Now, the problem is if I have given my data, health-related data, when I went in to see a doctor or somebody, okay, in a health profession, now they collected the data. Did I give them consent to transfer that data beyond borders for research purposes or for analysis purposes? And what is the law on those aspects? We don't have a clear-cut answer to this question. The other one is reuse of data for purpose other than the original purpose. The original purpose that we have given, it's for, let's say, for some treatment purposes. And if they are going to use these data for other than the treatment, then the privacy law differs from one province to the next. So it is going to be quite challenging to use the data, and most of them don't want to risk by using those data because they don't want to be sued for violating this particular law on privacy. The other one is retaining the data for longer than what is necessary or what is mandated by legislation. And they say it's a reasonable time. Again, reasonable time depends on the purpose and the data that have been collected. For example, EU had given 12 months period as the reasonable time. And in our legislation, we don't have that. And for example, if someone had collected the data and they need to do research on certain communicable diseases, it requires you to retain the data for a longer period to understand the pattern of the disease. And they have to collect it, and they have to collaborate it, and they have to analyze it to see. So that requires a longer period. And are we going to allow this retaining of the data? Do we have any exceptions? This is also another question that we don't find an answer in our legislation. The other one is explicit consent for collection and processing of the data. This have been mentioned under the legislation in section 6 or Article 6. But you remember when data are collected, you and me have given consent, whether you read it or not, we have given consent to use the data. And it's required, the legislation, be it a federal legislation or be it many of the provinces, they are asking the consent to collect data to be explicit, except with certain exceptions like public health, security, and other purposes. But it's going to be very challenging to get explicit consent. Okay, it's not always possible to get explicit consent. For example, there might be, we are using AI in collection of the data. We are using AI for data analysis. Okay, and big data and all these new technology are being used to analyze the data and to come up with a finding. Now, the question is, are the machines allowed to analyze the data and come up with a decision, and can they implement these decisions? If you look at the European Union laws and regulation on this point, it's very clearly said that if you are using a technology where there's no human involved, at least in the decision-making stage, there is a need for a human involvement. Without that, you may not be able to implement the decision based on the data that you have used it. Okay. Again, we could see there's not much of a talk in our legislation. And therefore, it is necessary under the current legislation of Canada, be it federal or many of the provinces, you need to give appropriate notice to the data subject. And means you have to give clear, timely notice of data collection and the use. And also you have to tell them the purpose for which you are collecting the data. Okay, even if you are using for, public educations, you might not use the personal information, but you might use the aggregated data, but at least it is better to let them know that this information might be used. Okay, and this kind of usage is exempted under Section 7, but there is no guidelines available so far and what extent these aggregated data or anonymized data could be used for public purpose. So in order to avoid any kind of misuse, there is a need for guidelines, and we don't have that. That's why the organizations, whoever using, be it public or private, whoever using the data, they need to have a proper standard so that they would be able to avoid any kind of problem later, okay, when it comes to anyone happen to challenge them. Now let's look at, I have drawn your attention to the federal law. I have brought up the federal law on the privacy law, the Privacy Act that's regulate the public sector, and also PPD that's regulate the commercial activities. Now, if you look at some of the provincial law, for example, the Manitoba, the Personal Health Information Act, it's also talking about regulating private sector as well as public sector information collections. And it tells that it is important to follow all the fairness principle before you processing. It's important that the consent need to be get. If there's no consent is given, the trustees should authorize the use of information, okay? And if you look at the Saskatchewan Health Information Act, it's also regulating the processing of personal information. And so this act allow them to come up with SHIN, where they compile all the information, the data, health data, so that they would be able to come up with so much of other decisions. Earlier, this particular act, it allows parties to opt out. Any patient, they can opt out from the system. But now with the new amendment, the parties have no right to object it. And also consent may be just not necessarily to get express or explicit consent to be put into the SIN. This is a little bit a bigger move for the province, similar to Alberta, which I will be talking to you later. Okay, unlike the federal law is still talking about explicit consent. But the provincial law, especially the Saskatchewan and Alberta, is moving away from getting explicit consent. That's a good move, but it's going to be a bit challenging because other provinces, they don't have a similar move made by their legislation. The Ontario Personal Health Information Protection Act is also regulates healthcare providers and also the facilities who process health data. And specifically mentioned about the requirement for collections and safeguarding of the health data and how to control abuses and the measures to protect all the integrity, and all those things have been discussed in here. Especially the particular act is talking about getting consent, which is not similar to Alberta or the Saskatchewan law. Albertan law is a bit of an advance in this sense. They regulate the health informations of the public sector, but any consent, it is not really, you can get even implied consents. It's not necessarily that the collections has to be only done after explicit consent. Now, so far you could see a few things in here. Number one, we don't have a single law, but we have few laws regulating. Federal law, we have Privacy Act, and then we have PPD. And Privacy Act regulates the public sector, whereas PPD is regulating the commercial organizations. Then we have each and every province, major provinces, they do have their law. Their law is not really in, they are not similar to the federal law. There are so much of differences. So they do have laws, but they are different. And therefore, when it transferring and collecting data and transferring from province to province and to various borders is going to create challenge to the organizations which are dealing with health data. Now, there was a proposed amendment to PPDA. That's a very good move that have been introduced in 2020. Okay, this bill is called as C11. It's an attempt to provide comprehensive new data protection law. Actually, if the bill is passed, then we would have two laws. One is the Consumer Privacy Protection Act. The other one is the Tribunal Personal Information Data Protection Tribunal Act. Please note this is a still bill. It's not passed as an act yet. Okay, if this bill is to be passed as act, then we have a good updated law. One of it, it's talking about one of the most important amendments is the data subject is given control over their personal information. Now, you as a person and you own your own personal data, you have given lots of right to control your data. You can say, no, I don't want to let it be in, and I want more information. I want my data, I want it to be deleted. There's so much control had been given to the individual, the data subject. And the organization also required to take enough measures under the privacy management program in providing privacy protections, and anything that they have to deal with privacy, they have to get consent, and it has to be explained in plain and clear language what they are giving, what they are collecting, what is the use, and how they would be able to correct if there is an error, and if they want to delete, and if they want to erase the data, and how to approach, all these details need to be given under the privacy management program. Then there is another right. This is a new right that have been introduced. It's similar to the European Union 2018 regulation, is the right to portability of data. You as an individual, you have a data in organization A, and you want to move that data from hospital A or organization A to organization B, you have a right. You can ask that organization A to move your data to organization B. Not only that, you also can ask that organization A to delete all the data that they have it. Means you have a right to make them forget about the data that they have. It means they have to delete it, and they have to use the system so that they will not be able to track back all the deleted data. The other one is also, okay, and related to the next one, they have the right to request for disposal of their personal information, especially when AI and machine technology is used to come up with decision. And if you feel those decisions are discriminatory, or those decisions are not in your favor, then you have a right to dispose. There was a Google case that happened in Spain, where it's sometimes a few years back, there was one gentleman had asked Google to remove the data, and that have been publicly available, and they failed. And for that, the Google Spain have been fined quite considerable amount of money for failing to dispose of the data that have been in their system. So it's quite a costly business for them if they don't remove it. But this is one of the best things that have been given to the individuals. Now, the next thing you would say, the bill, the formalized requirement of earlier, in the existing law, you might have a privacy management program, but the new amendment is making it compulsory for all the organizations to have a privacy management program with added responsibility. And also the bill is introducing more power, oversight power and enforcement power to the privacy commissioner. And the requirement of consent have been quite, I would say, have been made it again strong, where they said it has to be an explicit consent. It cannot be an implicit consent or implied consent. If it is an implied consent, then only can do it where the collection of data is within the reasonable expectation of the data subject, or the data is of low sensitive data. In those circumstances only, you can get an implied consent. Otherwise, the consent has to be explicit. This is going to create a little bit challenge for some of the organization. I'm not touching those things, but this is something good for the individuals, but may not be that very good for organizations. The other one is a new thing under the bill is creating a data protection tribunal. The tribunal would hear cases from or the decision from the Privacy Commissioner of Canada. It will function not based on the rules of evidence. They will look at the fairness and justice, the natural justice, without following the rules of evidence. And the tribunal is being vested with very strong power to impose penalties. One of the good things that you can see, even individuals whose data have been abused would be able to claim damages. So this is something which is very new, and it's not currently available under our law for the time being. Now, what I have mentioned under the bill, these are something new that they were planning to introduce. This is still a bill, and we are yet to wait. We are just waiting to get it passed, but I don't know when it's going to happen. But whatever have been mentioned, most of them have been already implemented elsewhere. I have mentioned in the EU, all the EU member countries, they have these laws. We are still quite behind. And while we are waiting for these laws to be passed and implemented, we as an organization or individual managing the organizations or advising the organizations, we need to follow certain, or we need to create certain standard. The standard number one is under the law, whether it's going to be the existing law or the new law, informed consent is becoming very important. So whether it is exceptional circumstances under Section 7, or under the normal circumstances, it is best for the organization to have a plan to opt in and opt out. Okay, if you want people to come in and consent, have the documents ready as an opt-in. If anyone wants to opt out, they don't want to participate, then you also have to give them the opportunity. And this one will create a trust, not only trust in the organization, but also will help you to be in compliance with the current law. The other issue, it's about retention period. Okay, it depends on various circumstances, because the retention period has to be reasonable. What is reasonable? It is depends on the cases. Okay, and I have mentioned EU mentioned as 12 in certain regulations, and the guideline of EU say 12 months is reasonable, but it might differ from case to case. And if your organization wants to retain more than what is reasonable, then you have to justify it. Okay, for example, let's say they are doing research, and for these research purposes, these analysis purposes, they have to collect out data and they have to keep it longer period, and then they have to be ready to justify it. And the retention period should be proportionate. And they cannot just collect extra data thinking that these data are going to be useful for future use. Okay, so it has to be something relevant and proportionate to the need, and the retention data has to be reasonable. If it is going to be beyond that reasonable period, then there should be enough justification. The other one is there should be an emphasis on the transparency. They need to take steps to inform about the collection of the data, the processing of the data, and it has to be, it's like the organization who are collecting data, they should have the responsibility from the cradle to the grave. So they have to have the information communicated to the data subject from the day one until the disposed of the data. Okay, and that clear communication will give them a better understanding how the data of certain individuals have been used. And the transparency is something is going to tell them the purpose for which they are using and how they have used it and how they have disposed it. Are they saving it? And if they're saving it, for what purpose? All these things would be explained through this transparency process. The other one, they also have to create an accountability measure with regard to the data, and they should introduce a full cycle of the data analysis to see and spot any weaknesses, any risk involved, because they know if they fail in any of the data processing step, from the collections, from the use to the disposal, it's going to create unnecessary trouble for the organization. So they have to do a data life cycle assessment so that they would be able to spot any weaknesses or any risk associated with the handling of the data. The other one is the data subjects should be given an opportunity to inspect, rectify, and delete any stored data if it has happened to be false data. Okay, this will create or promote a sense of control. This is what I was talking about, the bill, the new bill that have been introduced in here. It gives a lot of control to the data subject. So by allowing them to inspect, allowing them to rectify and delete any of the mistakes or data that they think it's outdated or is not correct, that will facilitate for them to control the data, what data it's been given, what data is used, and also it will control the liabilities on the organization, whoever using that data. The other thing it's going to be very useful for organizations and industries is the creation of data hubs. This will facilitate collection of health-related data to do analysis in the later period of time to see the certain pattern or certain issues that are related to health factors. But it also could give an information about location and other usage of the data related to certain diseases. But the thing is, when you are creating a data hub, it cannot be just one data center. It has to be multiple data centers. So it could be within a country, or it could be within, it could be a collaboration with various countries. So in these circumstances, data transfer is becoming imperative. You can't avoid those kind of data transfer. In those cases, though it falls within exceptions, it's always best for you to come up with the proper contractual terms so that it won't affect the research. At the same time, you would be able to control your liability. The other thing is, now a lot of companies and institutions they are using is blockchain, where using the blockchains, they would be able to make sure the data are only accessed by the people who have been authorized to access, and they have adequate licensing, and they do have control over the parties they're doing, because it's quite secured site, and therefore you would be able to control abuses. The other one, it's while you are doing this data transfer for research or as part of the hub that we have created or the organization had created, the European Union's Data Protection Board had given or introduced certain measures. Those measures are going to be really helpful in assessing the data transfer to other countries. It could be from Canada to other countries. For example, if you wanted to transfer, let's say, data from Canada to US, US doesn't have a law on data protection. Okay, they are quite different than what we have it, and also what European Union countries are having it. So the law in US on this matter, it is not comparable or compatible with Canada. So in those circumstances, they have to come up with certain agreement to make sure the party who is handling the data in US are contractually bound Okay, and they have certain privacy standards that they will ensure the data that have been transferred to US have been protected as if it's been protected or as it's been protected in Canada. And you also have to make sure that whoever it's going to use that data, it's not abusing the data. All these measures, they need to make sure that they have taken it before they transfer the data to other countries which doesn't have a similar protection like Canada. Now with that, let's look at what we have talked so far. The first thing I have mentioned to you, the Canadian laws like comprehensive law on the data, health data privacy, and they are not up to date. So while we are waiting for the updated law of C11, and the stakeholders need to take various standards in order to protect the privacy right of the individuals. Now, the standard could be different from organization to organizations, but whichever organization is, they should introduce principles related to accountability while they are following. Very important. You need to comply with the current law. Okay, if you are based in Ontario, you need to understand which part of the Ontarian health law is applied to you and to your organization, and also which part of the federal law is applied to you and to your organization. Along with that, whichever is missing, whichever you think that is not adequate, then one of the things that you can look at is accountability. The other one is transparency, because this accountability and transparency will take your organization and you for a long way in a good sense, and people are going to respect, and as if like you are having a good bank account balance. This is accountability and transparency will create a good image about your organization. The other thing is minimizations of data use. You have to collect the data which are necessary. You cannot just collect data for future use. If you're collecting a data for purpose A now, just collect for purpose A. You don't think about purpose B and C, which might be useful for next year, no. Okay, so minimization of data collection is one of the other thing. The next one is proportionality. So it has to be proportionate to the need for which you are collecting the data. So with that, I have done my part. Thank you for listening. If there's any question or anything, you're more than welcome.